Notion 2 enrolled 370 low-risk patients, but the key was they were aged 75 or younger, mean age 71. And importantly, about 100 of them had bicuspid aortic valves.
Right, that's a crucial subgroup. What was the main finding?
The primary endpoint composite of all-cause mortality, stroke, or rehospitalization at 12 months was actually not statistically different overall. It was 10.2% for TAVI versus 7.1% for SAVR. Numerically higher for TAVI, but not statistically significant.
Okay, so no clear win for TAVI there, unlike
Huh.
Dedicate. What about the specifics?
Yeah, the devil's in the details here. TAVI had lower risks of major bleeding and new atrial fibrillation, which you might expect,
Oh.
but it had higher risks of non-disabling stroke, needing a permanent pacemaker, and moderate or greater paravalvular leak, that leakage around the valve.
So a mixed bag of trade-offs.
Definitely. Pacemakers and PVL are known potential downsides of TAVI, especially in younger patients where valve durability is a bigger concern.
And what about the bicuspid versus tricuspid valve comparison within Notion 2? You said that was important.
This is really the key finding, I think. In patients with standard tricuspid valves, the primary endpoint risk was very similar, 8.7% for TAVI, 8.3% for SAVR.
Okay.
But in patients with bicuspid valves, the outcomes were markedly worse for TAVI, 14.3% event rate versus only 3.9% for SAVR. It strongly suggests that while TAVI might be a reasonable or even good option for younger, low-risk patients with tricuspid valves based on Dedicate and the tricuspid part of Notion 2, we need to be much, much more cautious about using it in those with bicuspid valves.
Right. That seems to be a clear warning signal.
Absolutely. The anatomy is different. The way the valve deploys can be different. It really underscores that TAVI isn't necessarily a one-size-fits-all replacement for surgery, especially in younger folks with specific anatomies.
So summarizing this TAVI versus SAVR section, short-term results look pretty good, maybe even surprisingly good, for TAVI in low-risk, younger-ish patients with tricuspid valves, but major caution needed for bicuspid valves.